Now, Gauteng is experiencing a surge of COVID-19 infections. The province's Coronavirus Command Council says there's been a rapid and sustained increase. It says the increase is no longer confined to Tshwane. eNCA's Heidi Giokos joins us for more. Heidi, good afternoon. I understand that you are at the Midrand Primary School. What is the sentiment from educators there around the rapid spread of Omicron? And exactly in terms of data, are they stating how many cases they've had so far?
Unfortunately, we do not have that information, Mfundo, because we do understand that teachers are out and busy, but the main issue here is the fact that Gauteng Provincial Coronavirus Command Council briefed today with regards to its readiness and preparedness around the fourth wave here in the province. We do understand that Gauteng is seeing a resurgence in cases, and yesterday there were 8,000 cases reported nationally, and 6,000 of those come from Gauteng alone, which just shows you how there's a rapid increase of Omicron variant here in the province. The data that is coming out specifically here in Gauteng still very early to figure out exactly what Omicron is doing, but we do understand it's highly transmissible. When you look at the statistics brought by doctors here from the Coronavirus Command Council, it's very clear that those that are being hospitalized and admitted fall into the category between 20 years old and 39 years old. A very different picture to what we saw in the third wave. And the reason for this, Mfundo, is because they are possibly predicting that it could be due to low vaccination numbers in this particular age group. In the third wave, what was very clear was the fact that those being hospitalized fall into the category of 60 and above, 50 and above, because many of them had not been vaccinated, and they fall into the vulnerable and high-risk age group. Whereas now, you're probably asking why those between the ages of 20 to 39 are falling sick and getting into hospital or admitted because of COVID-19. It's because Gauteng experts are predicting that it's got a lot to do with the low vaccination number. It's a worrying picture, and the message is very clear from Gauteng Coronavirus Command Council. If you aren't vaccinated yet, get vaccinated, because the data is very clear. It protects against severe COVID-19 and possible death.
Heidi, we even heard the Premier stating that there was a lot of hype around the below 40s vaccination period, but it seems they were unable to sustain this. But he has in fact committed that they'll be making a greater effort to get this cohort vaccinated. What else did he go on to stress about this?
So if we just put it into perspective, 7 million people, over 7 million people have been vaccinated here in Gauteng. They still need to vaccinate 8 million people in Gauteng alone. This is a worrying picture for the Premier and all involved, because we do understand that there's a lot of vaccine hesitancy. The Premier, together with the MEC of Basic Education, Panyaza Lesufi, as well as the MEC for Health and other health experts, have been actually mobilizing here in the area in Midrand, trying to get as many people vaccinated as possible. And this is the message, to say that if you have not been vaccinated as yet, you should do so. Another big concern, Mfundo, is people not going back for their second jab. Unfortunately, Gauteng Coronavirus Command Council has not been able to give an exact number, but we do know that if you've received one Pfizer shot, you have between 42 to 90 days to go back for your second jab. And the number that the province is looking at is over 700,000 that are in the pipeline to go for their second jab. So it's a concern for them. They're trying as best to get people to get vaccinated, but there's a lot of hesitancy. So they're trying to educate, they're trying to get people to understand the importance of this vaccine and the benefits thereof, especially with Omicron. Even though there's very little data out, they want people to understand that there is some kind of efficacy and protection against COVID-19 once you are vaccinated.
Now, Heidi, thank you very much for that update. That's eNCA's reporter Heidi Giokos.